Good morning, everyone. It's Dr. Eric, your fitness physician, going to give a short PowerPoint or keynote presentation. And I'll do an audio just on either on a whiteboard or just me talking, just kind of the summary, quick points too. I'm talking about, as you know, I love talking about the peptides. I use them a lot in my clinical practice with great success. And I'm going to talk today about BPC 157. This is one of my favorite peptides because it's so safe and so effective. It has so many applications. So it stands for body protection compound, right? So it's it's basically the most widely used peptide in the world. It's been used for many years, decades actually, and really no reported side effects or toxicity. So it's potent, it's safe, and it's very specific. And it's specific, but it's also very wide-ranging, and it has numerous effects. And I'm going to get into that a little bit more in these slides. So basically, it's interesting because it's the unicorn of the peptide universe. What I mean by that is that nobody really knows how the heck it works. It doesn't have any direct effects on cells that we can determine. It acts as a signaling agent, and it upregulates many genes, and so it can affect epigenetic expression. And again, by signaling other enzymes, other peptides, other proteins, other hormones, telling them what the heck to do. It upregulates what needs to be upregulated and downregulates what needs to be downregulated. So it's almost similar to the adaptogens, and it just helps the body do what it needs to do. So it actually was originally isolated from the gastric juice in your stomach. It's highly stable, it's resistant to digestion, so it's one of the few peptides that can be taken orally. So it has a lot of different uses and forms of administration. As I mentioned, it can be given orally, but also given subcutaneously, can be given IM, intranasal, and even topically. There's some pretty cool combinations of peptides that can be used topically for wounds and skin care, which I'll talk about on future video presentations. So stay tuned to my channel, guys. So one of the biggest things that it's for is its anti-inflammatory effects. Tons of anti-inflammatory effects. It's basically the healing peptide, right? It heals tendon, bone, muscle, teeth, your cornea, muscle, bone, intestine. So one of the biggest uses, I think, is for my patients, even myself, I've tried it on myself, is to healing injuries, whether it's tendinitis, tendon injuries, muscle injuries, ligament injuries, and certainly awesome for healing the gut, whether it's SIBO, leaky gut, inflammatory bowel problems, ulcers, all these things. And then the other awesome thing is why I love using a synergy with the growth hormone releasing hormone peptides such as CJC, epimorelin, etc., is that BPC upregulates the growth hormone receptor, so it makes it work, the CJC, etc., work more effectively because the receptors that they are working on are upregulated. So sometimes they need even less of the GH peptide for it to work. So these work fantastic together. So everything, there's the method to madness, right? They all work great together. So decreased inflammatory response to the BPC has a lot of effect on decreasing some of those inflammatory mediators like leukotriene, B4 thromboxane, and myeloperoxidase. It can increase the secretion of collagen and again promote cell regeneration, proliferation, and healing. As I mentioned, it can induce some IGF-1 locally to help with the healing effects and the growth of the damaged tissue, repair the damaged tissue. It can activate such enzymes as tyrosine kinase. These are all involved in healing and proliferation of the cells, which is a good thing. It can also induce what's called F-actin formation, the fibroblasts. These are basically like, everybody's heard of actin and myosin in the muscle, but there's also actin filaments elsewhere in the body too, and it can help with fibroblasts, which are what helps repair collagen and fascia and some of the other soft tissues. This is why it's so great for healing soft tissue injuries. I'll talk about later on when I'll talk about some of the other peptides like thymosin alpha and beta that also work on some of these and help with healing as well. So again, it helps not only with fibroblasts with the formation of this F-actin molecule, but also with migration of these fibroblasts so they get to where they need to go. So if you have an injured tendon in your shoulder, for example, it'll help these fibroblasts get to where they need to go and heal. So there's, and also to help with this healing process, it'll help with some of the expression, the vasculature, and the blood vessels of like VEGF, which is vascular endothelial growth factor, and other ones too, like IGF, fibroblast growth factor, platelet-derived growth factor, and transforming growth factor, which I've enumerated here on the slides with all these wonderful initials and ladders, like alphabet soup. So BPC also can help with cell survival under stress, under oxidative stress. So of course, we're all under tons of oxidative stress every day from all the toxins, stress, etc. Here's a cool slide showing the impact of muscle healing. This is under steroid application, like prednisone, etc. You can see the damaged muscle after 14 days with a control with nothing and with BPC. I know this may not mean much to you, but basically you could just see it. Even if you just looked it up on Google, I should have put some additional slides, but basically on the right is what a normal muscle tissue looks like. Pink, thick, etc. On the left, it shows that it's damaged, it's thin, it's kind of disarrayed. It just shows some incredible healing. This is a cool picture of a slide borrowed from one of my colleagues at the IPS from corneal ulcer. It's kind of hard to see it exactly. It just looks like a bloodshot eye, but the ulcer, there's definitely an ulceration on the bottom, and you can see it massively, quickly healed up on below. BPC has a ton of other cool effects too. It's neuroprotective, protective for the brain. It can help with nerve regeneration, decrease neuroinflammation, and it has a lot of systemic effects in the body from a neurologic perspective too. It has an antidepressant effect, and it can influence the serotonergic, GABAergic, and dopaminergic systems. So all these neurochemicals are basically important in the brain for motivation, for drive, for mood. It helps with, again, it has a lot of effects with, people that have abnormalities in these systems can have many problems in terms of, like I said, motivation, drive. Can be depressed or overexcited or overly anxious if your serotonin, dopamine, or GABA is out of whack. So it can massively influence these. So it can help not only with, such issues as these, like talking like me, but in terms of mood disorders and things of this nature, but it's also been found to help with ameliorate the symptoms of alcohol withdrawal. So it has a lot of broad-reaching implications. So it's been in touch with the neuropsychiatric community as well, because it can help so much with these symptoms. Again, some of these neurotransmitters and neurochemicals are massively important, as we're finding out, in a lot of conditions, and this is one of many that can help with that. So probably another reason that it's used in traumatic brain injury patients too, because it can help get these neurochemicals back into alignment. BPC has a lot of benefit for the heart. It's cardioprotective, can help with blood pressure regulation, protect against irregularities in heart rhythm secondary to certain medications, and helps with improvement of nitric oxide, which can help with the vasodilation of the blood vessels, which is obviously a great thing, protective against blood pressure and helping with blood flow for healing and regeneration. As I mentioned, it's effective in TBI, traumatic brain injury, neuroprotective. And again, one of the things I really want to talk about is gut healing. Tons of GI healing, whether it's ulcers, GERD, which is reflux disease, or eosinophilic esophagitis, which is becoming more and more prevalent, which is a form of irritation of the esophagus, which can cause symptoms similar to reflux, problems swallowing, things of this nature. Has a lot of broad-reaching implications for treatment for intestinal pathology like Crohn's disease, ulcerative colitis, or SIBO, small intestinal bacterial overgrowth. It can restore that esophageal sphincter pressure, which is one of the main causes for reflux and heartburn. So as you probably read more and more about people having problems with this leaky gut, ulcers, Crohn's disease, SIBO, all these things, and it has massive healing effects. I've done it myself for some gut issues I've had. I've had several friends with eosinophilic esophagitis, say that 5 times fast, and ulcers, and tremendous improvements. So this is a great gut healing peptide. So I think most common applications, again, is gut and soft tissues. Works amazingly well. Again, we talked about bone healing, and it's also helpful for periodontitis, tooth infections, skin burns, and corneal injuries, as I mentioned. Again, as I mentioned briefly earlier, that there's a topical form for burns and wounds. It's also been helpful for things like food intolerance with secondary histamine elevations, and for weaning people off chronic proton pump inhibitors, which again can help with the gut healing. Some of these medications like PPIs, as we'll talk about in future lectures on peptides, there's a lot of medications that can adversely affect our cells and our cellular function, mitochondrial function, and can promote the aging process. Many of them, and PPIs are one of them. So if we can avoid these, all the better, right? So it can be helpful for getting people off these PPIs, healing that gut. So dosage, many ways to do it. Roughly half-life of 4 to 5 hours. Usually we shoot for around 400 to 600 micrograms a day. You can divide it up, especially for injuries. Oral forms, they come in tablets of 250 to 500 milligrams. You could take 2 of these a day or more. People with severe gut issues can take up to 1 gram a day or more sometimes, for at least for a short term. Again, some long-term studies have been done, and again, there's no reported side effects. For people have been on this for months, even years, with no side effects, no problems whatsoever. So again, you could do it once or twice a day, especially if there's an injury or post-recovery. You can dose it several times a day. So we'll get into this on future slides, and that's it. So wanted to give you a quick talk on BPC, guys. It's a great peptide, used it a ton. All my patients love it. So if you have any questions, want to learn more, please reach out to me, Dr. Eric, your fitness physician and peptide doc. Everyone have a fantastic day.